Is Colorectal Cancer Awareness Month, and the best way to prevent or detect colon cancer early is still a colonoscopy. This morning, WMAR 2 News' Abby Isaacs has a look at how one of our local hospital systems is trying to make it easier for people to get one.
They've made the initial screenings virtual, so it's just one visit for the colonoscopy. With less barriers, more people are interested. It was last summer. Sarah Meadows Shaw felt like something was off.
My body started to feel a certain way, and I thought, that's not how it usually feels. I think I should do something.
She learned that, being 45 years old, it was now recommended that she get a colonoscopy.
So I decided it was time to pull the trigger.
But the decision seemed a lot easier than actually getting the procedure done.
I tried to call a couple of doctors, and they said, well, you're going to need to make an initial consultation appointment.
Shaw would have had to wait about 6 weeks to get the colonoscopy, and it just wasn't feasible as a mother of 2 young kids.
I did not have the luxury of being able to take off so much time to get a consultation and then another appointment for the colonoscopy. And I just thought that was crazy.
But then a friend told her about MedStar Health's new expedited screening process, and she got her colonoscopy a week later.
It was fantastic that I could just get in and out, same day, one appointment, and have it done.
MedStar Health is now using telehealth for the initial consult for otherwise healthy patients, instead of having them come in person to talk about the colonoscopy and then set it up.
So if we eliminate that barrier and just say, hey, just come do it, I think you're more likely to say, okay, well, I could skip a step. They made it easier for me to do.
Dr. David Stein says more people are reaching out because they're hearing by word of mouth how much easier it is.
Just recently, we did a colonoscopy on an individual, same thing, and we detected 2 large polyps. Again, it's like, wow, I had no symptoms, I felt great. Why did I have those polyps? Screening is really important.
He says making it easier likely brought that patient in and prevented colon cancer.
It's the 3rd most common cancer in men and women, 2nd leading cause of cancer death, and we can prevent it with a test. No brainer.
For Shaw, the new system also meant having an answer as quickly as possible, which was a huge relief.
You know how it is in your brain, you start thinking the worst. You're like, oh, it's going to be bad. Now, thankfully, it was, I have a clean colon, so that's fantastic.
She says if you're 45 years or older, or it's been 10 years since your last colonoscopy, what are you waiting for?
It's not a big deal, and if you can get in and out one day, you should do it.
There's also a stool DNA testing kit you can get to test for polyps, and those kits have become more popular recently because you can do them completely from home. For WMAR 2 News, I'm Abby Isaacs.